We're all human, and it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships, while the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show. The focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida, and welcome. South Florida and beyond, and globally on the iHeartRadio app. Welcome to Doctors Are People Too. This is our second show. Last week we had cardiac surgeon Dr. Brian Bethay on the show, a heart surgeon with Tenet Florida Physician Services and the Regional Medical Director of Cardiovascular Surgery for Tenet Florida. And today we're going to talk about another region of the body, regions of the body, I should say, the ears, the nose, and the throat with Dr. David Brodner, an otolaryngologist, say that 3 times fast, who's on staff actually at a few Tenet hospitals, Delray Medical Center and Good Samaritan Medical Center, and then also has an office in Boynton Beach, in a new part of Boynton Beach, the Canyon Town Center. Beautiful area. I've been out there a few times. I'm actually a Boynton Beach resident, so I really think that's a gem out there. I'm going to introduce the doctor, but first I just want to let you know a little bit about myself. I'm David DePino. During the day, I'm a public relations and marketing specialist. At night, I put on my Superman costume here, and I do a little radio show called Doctors Are People Too. We want to focus on the doctor's areas of interest, but actually learn a little bit more what they do when they're away from providing, treatment for patients and doing surgery. Personally, I've been writing professionally since 1999. I'm a native South Floridian, which I believe the doctor is. We'll have to ask him that, make sure. And I've written for the Sun Sentinel newspaper, Delray Forum, as well as the Tribune Company and Forum Publishing Group, and 50 other papers in South Florida, including the Palm Beach Post. So I've spent a lot of time writing. Now I'm in healthcare doing PR and marketing. I still do a little writing with a couple of newspapers in the area, freelancing with the Delray newspaper. That's formerly the Pineapple newspaper, and Delray Beach and Boca newspaper. And this is my second show, and my guest is Dr. David Brodner. As I said, he's an otolaryngologist. You'll have to help me with that, doctor, in a second. And before we start with the doctor, May is Allergy Awareness Month, and it's also Better Sleep Month. So, Dr. David Brodner, thank you for taking the time from your busy schedule. How are you doing?
I'm doing great. Thanks for having me. Excited to be here.
Thank you for coming.
And it's otolaryngology.
Oh,
but
thank you.
You can just say ear, nose, and throat.
We can say ENT, right?
ENT, yeah.
Okay, that's easier. So, we know a little bit about your medical specialty, but you're double board certified in otolaryngology, sinus surgery, and sleep medicine. Before we get into sleep medicine and the treatments for sinus issues, what is otolaryngology? It's got me all messed up there.
Well, otolaryngology is ear, nose, and throat. It is a very broad specialty. You can see kids with ear tubes to elderly folks with hearing loss. You can do facial plastic surgery like nose jobs to big cancer cases, or, as I specialize in, sinus issues, allergy, and sleep problems.
Wow, so it covers a lot of gamuts.
It covers a lot
medicine.
of real estate. So I've really focused on the 3: sinus, allergy, and sleep.
Before we get into that real estate, I always ask this question first. Why did you choose to become a doctor, and how did you do it? What was your path?
Well, my father's a neurosurgeon. He's actually been at Good Sam since the 80s, so however long that is, 35 years maybe. So that probably guided me towards the path of medicine, and it was always going to be my path, so I never really gave it much thought. It was just go to college, go to med school, go to residency.
And how did you choose these specialties?
I definitely chose ENT because of its breadth, so that when I got through all my training, I could really have a lot of options to choose from and see what I liked and focus on it.
Nice. And we couldn't have you, like I said, at a better time than, May is Better Sleep Month, which is a health observance brought to us by the Better Sleep Council. What is sleep medicine, Dr. Brodner?
Well, sleep medicine is a specialty of medicine that concentrates on sleep disorders. And there's actually over 80 sleep disorders. So not only is there a wide variety of sleep disorders, but the prevalence is so high. I mean, just a huge number of people in our population suffer from sleep problems, sleep deprivation. And not only does it affect our health, but it affects our efficiencies at work, and sleep is important for everything in our life. So it evolved into its own subspecialty, and in 2007, I believe, it became a recognized board specialty. So that's when I got board certified.
And right into my next question, this goes deep into sleep, or actually not sleeping. What is insomnia and how is it treated?
Well, actually, insomnia is not only problems falling asleep, but it could be problems staying asleep, or it could be you sleep, but it's unrefreshing. There is a large population of insomniacs, and the best way to treat it is not with medication, although pharmaceutical companies love to run the ads, and a lot of people have medicines thrown at them. But if you look at the studies, the medicines really don't help that much. Maybe they give you a benefit of 45 minutes, but you have to combine it with what we call cognitive behavioral therapy, and that's just a fancy way of saying changing your sleep habits. So I always describe to my patients, sleep is a habit, and when you have nice, good sleep, healthy sleep, you don't think about it. But when you have a bad habit, that's when you have insomnia. And my job is to show you the path of getting that better sleep habit. And actually, I've incorporated a program on the internet called Shut-Eye, where the patient can actually log in, and not only does it give them tips and help with their sleep progress, but they input their sleep schedules and patterns, and then I can access it. So it's getting pretty high tech.
Wow, and you can study the pattern.
That's right, because patterns in insomnia, that's all about. So we want to establish a consistent pattern, and then over the period of weeks to months, I can gradually change your sleep pattern so that you can sleep 7 or 8 hours, which is the recommended amount.
Wow, that's really neat. And then I'll ask this question because I'm guilty of this. How can snoring become a serious health issue for the well-being of an individual?
That is a great question. Snoring used to be kind of a joke. You know, oh, I snore, oh, it bothers the wife, it doesn't bother me. But we know now that snoring can be the sign of a serious medical problem called obstructive sleep apnea. And basically, sleep apnea means you actually stop breathing while you're sleeping. So the person is choking while they sleep. They don't even realize it, and it can happen multiple times in an hour, 30, 40, up to 100 times in an hour. So not only does that give you bad sleep, so the person is tired, but it causes a lot of stress on the body, increases the risk of things like heart attacks and strokes and atrial fibrillation, congestive heart failure, increases the risk of motor vehicle accidents. You'll see a lot of big news stories where transportation accidents are caused by the train conductor having fallen asleep because he wasn't treating his sleep apnea, or truck drivers that don't use their CPAP. So it is becoming a quickly more recognized problem.
Yeah, we just had that happen with the train conductor. And
Exactly.
that's very timely in the news. And there is two-part question here. I'm just adding this. Sometimes with sleep apnea, and I feel like right before I wake up, I get really excited, and it's like really excitement, and you think to yourself, well, I just woke up, I should be rested. I mean, what is that? So what's going on there? And then how is sleep apnea treated?
Well, sleep apnea is actually that you stop breathing, and so the body's response is to be woken up. So it's almost like you're sleeping and someone scares you and you jolt awake. That's what's happening in sleep apnea. So when you jolt awake, a lot of times you just fall right back to sleep. But sometimes it really causes an arousal, and your heart will be beating fast, and you're like, wow, what's going on? Well, imagine the stress on your heart and your whole vascular system when that's happening 30, 40 times in an hour, every night you sleep. Over time, it causes too much stress on the heart. So that's what's going on. How do we treat sleep apnea? There's a variety of options. There is a mask called CPAP. That's the most traditional option. There are oral appliances, a plastic mouthpiece that a sleep dentist can make. There are a variety of surgeries that I perform on the nose and the throat. And interestingly enough, there's a brand new surgery out, and I was just certified as a site for a clinical trial. It's called ImThera, and basically it's a pacemaker for your tongue. It's an electrical stimulator I place in the chest. There's a little wire under the skin, and I clamp it to the nerve of the tongue. And when the person's asleep, it stimulates the tongue, strengthens the tongue so the tongue doesn't fall back, and the person's sleep apnea disappears. So if you hate your CPAP, can't deal with your CPAP, now there is an excellent option, a surgical option, not the old option where we would go in and take tonsils out and real painful throat surgery, but a much more higher tech, advanced treatment system.
And we're going to come back on that. I just want to give the number out really quick, 1-888-565-1470, and we'll talk more to Dr. David Brodner after the break.
Actually, I was born in Italy. I was born in Sicily. Buongiorno. I've been traveling for years and years and years. And as I like to say, and I've said this repeatedly, I collect countries like people collect stamps. So I've been to over 100 countries. And as I said, that's my passion in photography. And they go hand in hand because I can't travel without a camera. I was having dinner with some friends, and I fainted, and that was the beginning of everything. It was a matter of my heart. My heart was so weak. I was almost dead, so the question became, am I ready to die at this moment? Initially, I had a defibrillator that had 2 wires. And what was happening was that one chamber of my heart was just flopping around. So Dr. Wiseman came up with the idea of implanting a defibrillator with 3 wires so that the 2 chambers would work in unison. Dr. Wiseman recommended Dr. Habib, who he said deals with these matters. He said that my face was gray, my lips were purple, and he knew that I was getting ready to die. He knew that the only options for me was either go through the LVAD procedure or go to a hospice. So essentially, I have an artificial pump inside of me. There's a cable that comes out of my midriff that's connected to this system controller, which is like a little computer. And I have to either be on batteries all the time, or I have to be connected to a power module, which is connected to the wall. And now I'm still alive because of the LVAD surgery. I want to try traveling again, taking photographs again. I would like to get back to Italy, of course, because I feel very comfortable in Italy. I have relatives there. And I love Italy because Italy is like a piece of art. Thank you for my life. Grazie tanto. Thank you very much.
You are listening to Doctors Are People Too with David DePino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back. We're here with Dr. David Brodner, and I'm going to call him an ENT because I butchered the medical specialty a few times. Dr. Brodner is medical director at Good Samaritan Medical Center, the sleep laboratory there. And we're going to get a little bit into sinuses, which I think is an important topic because I always hear about people with sinus infections and whatnot. So, Dr. Brodner, we've all had them. What is a sinus infection and how is it treated?
Well, basically, a sinus infection is an infection in the sinuses, which are air-filled spaces in our skull. So we have some in the forehead, cheek, between the eyes, and in the back. And you know you have a sinus infection or a sinusitis if you have stuffy nose, pain or pressure in the face, drainage down the back of the throat. You can sometimes, a lot of times, green and yellow stuff coming out of the nose. It can even lead to things like bad breath or a cough. Most commonly caused by a virus, like a cold, but if it lasts 5 days and it's getting worse, or it's gone 10 days and not getting better, then it's more likely to be a bacteria and you need an antibiotic. So at least in my office, when you come in, we'll culture it. We put a little Q-tip in there, and that tells us if there's a bacteria or not, and if there is, it tells us exactly what antibiotic to use, because unfortunately, antibiotics are given a little too often when they probably didn't need to be. Couple easy ways to treat a sinus infection, a lot of over-the-counter stuff now. So saline rinses, like a Neomed wash, Mucinex, it's high-dose guaifenesin. Now there's a lot of over-the-counter nose sprays. It used to be prescription, Flonase, Nasacort, Rhinocort. So those are all real good. Now when a sinus infection happens too often, so you need 4 antibiotics in a year, or you've got one that doesn't go away, or you have sinus headaches, just pressure here, usually gets worse when the weather changes or temperature, or if you lean over, then that's where I come in, and I can also treat it not medically, but surgically, and help the sinuses to function better.
Okay, and that is the in-office balloon sinus surgery.
Yeah, so traditionally sinus surgery was in the operating room, and they would do things like cut away or scrape away tissue, and that was good, but cutting and scraping, as you can imagine, probably leads to pain, bleeding, scarring. So everything in surgery is minimally invasive, and for the sinuses, they use a tiny balloon, and it came from angioplasty, heart technology. And so now I can put a tiny balloon in your sinus. You inflate the balloon, which then opens the sinus. Then you remove the balloon. Balloon doesn't stay in there, but the sinus stays open, and it stays open permanently. Now, I use it in the operating room, but now we can also do it in the office. And the nice thing about the office is that you're wide awake. It's just some numbing medicine in the nose. It's easier than getting your teeth cleaned, 30 minutes in and out. You can head right out of the office, go to lunch, go to the movies, go to the mall, play cards, whatever you like. So that's really revolutionized the treatment of sinuses. And we've been lucky when in 2010 it was becoming mainstream. I was involved in one of the companies that developed it. So we did the clinical trials in my office, and we have surgeons who come to our office, and I teach them how to use the balloon technology. So it's been working real well.
And that's amazing. And if anyone wants to talk to David Brodner, we only have a few minutes left, but our number is 888-565-1470. I'm just amazed that that's minimally invasive, that you can walk out of the office, but years ago it was done in surgery. I mean,
Absolutely.
Well, still
Technology is
surgery.
wonderful.
Now, I read that your office also specializes in allergy testing and allergy treatment. Can you tell me a little bit more about that?
Sure. So allergies, itchy, watery eyes, runny nose, sneezing, it's very prevalent in Florida, basically because we don't have seasons. It's allergy season all year round. So one of the ways that we treat allergies is with nose sprays and rinses, but when the medicine's not doing the trick, then we'll do allergy testing, see what you're allergic to, and then we can more aggressively treat it, maybe with allergy shots, which maybe you've heard of, or allergy drops, which is like shots, but you don't have to go into the office and no needles. We have a quick test where we do little skin pricks on the arm. That tells us what you're allergic to. We're also testing for food allergies now. And there are a certain amount of people, not many, but we can also do a blood test for allergies. But the skin test is generally better. And with that knowledge, with the actual data, then I can just treat you better rather than a shotgun approach of try this, oh, it didn't work, try something else. I really like to direct my treatment with some testing, so there's really little to no guesswork.
Nice. And you made a great point there. Food allergies, we're hearing so much about it with all the gluten-free,
Right.
the paleo, the this and the that. But that's like an important part of healthcare right now.
Food allergies are definitely kind of in vogue, if you will. Food allergies are really a little controversial. How to really diagnose them would involve kind of a food diary where we tell you don't eat corn for a few days, see how you are. Don't eat gluten for a few days. So food allergies can be a little more complicated, but yep, they exist, and we do evaluate and treat for them.
As a series of treatments, they obviously come in, you need to do a little testing at the beginning to find out what's going on with the patient, but is it something that they see you for over a period of time for?
When you put somebody on allergy shots or allergy drops, generally you'll know within the first 6 months if it's going to work. And if it does, which 85% of the time it does, then it's a 3 to 5 year commitment. But again, the drops you can do at home. When you do shots, you do go into one of our offices, but eventually when you get to maintenance, it's a once-a-month visit. But it really decreases not only the symptoms and the suffering, but the amount of medicine. So a lot of people find the time commitment well worth it.
That's more great information from Dr. Brodner. He treats so many different ailments. I'm so amazed at the ENT specialty. Now, you also treat the throat. And can you talk about how and why a sore throat develops and the treatment options available for a sore throat?
Sure. Again, the more common reason you're going to get a sore throat is a virus or a cold. And that'll last a few days and then it'll go away. But if it's lasting a little bit too long, then you can have a bacteria. Everyone hears about strep throat. So again, my general philosophy is culture before you treat with antibiotics. Sometimes you get a rapid strep if you're in an urgent care, but you can really tell a strep throat if it's really red, real painful. You have some white exudate or junk in the back of the throat. But overall, sore throats are common, but also very easy to treat. Although I had a gentleman just today who had an abscess, so his infection was caught behind the tonsil, and that was a little unpleasant for him because we had to take a big needle, and I stick it right in his throat, and we had to evacuate or get all the pus out. So, generally that doesn't happen, but it just so happened this morning. So a sore throat that lasts too long, definitely go see someone about it.
Okay, so if it happens, you're the guy.
I am one of the guys, yes, an ENT, an otolaryngologist.
Thank you for that. I appreciate it. So this is kind of my curveball question of doctors are people too, and we ask it every week. When you're not, providing great ENT treatments or, sleep medicine or performing surgery, do you have any hobbies or pastimes maybe that help you get away from and kind of give the brain a break from, medicine?
Sure. Well, I've got, a wife, 4 kids, and 2 dogs, so I've got lots of things to do there. But when I'm not at work or with the family, my main hobby is playing poker. Texas no limit hold'em. So that's my thing. So I like to play poker.
That's so neat. I love asking that question because you never know what you're going to get. Now, do you play in any satellite tournaments?
As a matter of fact, on Saturday, I'm going to be playing at the Smoke Inn. I have to defend my title because I won last year. I won a seat to the main event in Vegas. I didn't cash, unfortunately, but I'm going to try to defend my title, win again, and get back to Vegas.
So that's the Smoke Inn there in Delray Beach.
They have several of them.
Okay,
They
several
sponsor
now.
once a year a satellite tournament to the main event, so that's fun.
Since we're talking about location, now you are located at 8794 Boynton Beach Boulevard, Suite 208. That's in Boynton Beach, and your phone number is 561-735-8750. That's www.brodner, that's BRODNERMD.com. Now, we talked briefly at the beginning, or I did, about the location of your office. Now, you're out there in the Canyon Town Center,
Yes.
and that's out at Boynton Beach Boulevard and Lyons Road.
That's right. We're about a mile west of the Turnpike on Boynton Beach Boulevard. It's the Canyon Town Center is a nice shopping center, has a Publix, and we just happen to be right over Alabama Joe's. So if you know where Alabama Joe's is, I'm right upstairs.
That's an awesome restaurant, too. I know exactly where you're at.
We give them a plug.
That's great. And that's a new plaza, too, as well.
It is relatively new. It's really nice and well kept, so we like it a lot.
Now, going back to the second curveball, you hit the first one down the middle. Do you have a favorite sports team you follow? I see you went to Duke, but you also Tulane and University of Florida.
I did. I went to all 3, but I am a big Duke fan, big Duke basketball, which is not hard to be a fan of because they've been quite successful. When I was there, they went to 4 Final Fours, 3 championships, and won 2 of them. So, but I don't know if it translates, but everything in my office is Duke blue. So,
and you've been to Cameron Indoor State. You're Cameron crazy?
Cameron. Yeah, I am. My firstborn, his middle name is Cameron. So.
Oh, wow. And they're still doing. I mean, Coach.
Fantastic.
Coach K.
They might have the number 1 pick this year again.
Wow.
In the draft.
And this gets into a part of the program. I have a couple extras, and I was happy that the doctor would look into this for me. I know he gets this question all the time. It's a common question. Are Q-tips safe for the inside of the ear, and should I be using a Q-tip on a daily basis, especially when I get out of the shower to dry the inner ear?
Yes, well, we tell everyone don't use Q-tips. As a matter of fact, if you flip the Q-tips box around, you'll see it says don't put it in your ear. It was originally designed for women or whomever to put on makeup. So if you feel like there's water in your ear, just use your bath towel because it won't go too deep. It'll wick the water out. We usually explain it like the old Revolutionary War musketeers. The Q-tip is just packing the wax down in deep. So the wax is good. It helps fight infection, and it will come out on its own. So all the Q-tips do is it makes it worse, packs it in there, and then, of course, every so often you can damage the inside of your canal, get an infection, or puncture the eardrum. So stay away from Q-tips.
And I'm sure you've heard this question as well in all your years of medicine. What about the hot wax poured into the ear? So what I'm talking about is I've seen this done, and it was perplexing. Someone lays on the ground, and someone else pours hot wax into the ear. It hardens, and then the person pulls it out, and the earwax comes with it.
Yeah, that was very popular a couple of years ago, and it's almost like a magic trick. But number one, it's never a good idea to have anything on fire near your ear. So, but it was so popular that they actually did studies to prove that it doesn't work. But essentially, the wax candle, they call it, is made out of wax. So I think what you're actually seeing is the wax candle, its own wax. But when people use it, it actually creates this dust that sticks to your eardrum, and it's impossible to get off. So that's a side effect that nobody knows about. But really, wax candling has kind of gone out of favor because I haven't seen anybody who's done it in a few years. But yeah, they actually did scientific studies. It doesn't work.
Oh, good. And you do a lot of research as well. I saw that on your website. You're all involved in a ton of research projects.
Yes, I have been lucky enough to be involved in research. We did clinical trials, like I mentioned, for the balloon, and now we are doing the clinical trial for that new sleep apnea surgery, the pacemaker for the tongue, the hypoglossal nerve therapy. I'll also be running a clinical trial for a new nasal treatment called Spirox for the nasal valve and one for the turbinates. So, yeah, we like to keep up with the technology, be real ahead of the curve, so we can offer you a really advanced ENT in little West Boynton Beach.
Nice. I just want to give out your information one more time because I know we're close here. Dr. David Brodner, 8794 Boynton Beach Boulevard, Suite 208. That's 561-735-8750. And easier is Brodner, BRODNERMD.com. Now I got to get in my question here. I've seen a lot of concerts, including Pearl Jam 18 times. I just want to talk a little bit about earplugs at concerts. I've seen a lot. I think the music's getting louder. It's crazy how loud the last few shows I've seen. Why is it so important to wear earplugs at any age?
Absolutely. I saw my first Pearl Jam concert last month. I went over to Tampa with a friend. So it is loud, and loud noises, especially at concerts, could be louder than a plane engine or an explosion. So it is crazy, and you can get acoustic trauma. It can permanently damage your hearing nerves. So if you're going to be around loud noises, definitely protect your ears. Use some common sense. Don't put your ear near the speaker. If it's painful, then it should be protected. And
that's a good point.
More than Pearl Jam concerts, it's people wearing the earbuds, and they can really turn up the volume. And I think in a few years we're going to be seeing it, and really because all the kids are wearing the earphones and earbuds and listening to music too loud.
I think that's all we have time for, Dr.
All right.
Brodner.
Otolaryngology.
Yeah, I got it.
3 times.
Otolaryngology.
There you go. You see?
I got it
Perfect.
finally. It took the whole
Perfect.
show. So I really appreciate you coming
Well, thanks
on.
for having me. I liked it.
And we're definitely gonna have you back.
I would love to.
I mean, I could go. I think an hour or two with you, and you're
Great.
very easy to talk to, and
Excellent.
it's been great. So thank you.
Thank you for listening and watching Doctors Are People Too with David DePino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers.